for specified family and medical reasons, with continuation of group health coverage under the same terms and conditions as if the employee had not taken leave. FMLA helps employees who must deal with their own serious illness, the illness of an FMLA-defined qualifying family member, or for the birth, adoption, or new placement of a foster child into the home. The benefits of FMLA is the freedom from worrying of losing one's jobs due to these life events. And it protects the mental well-being of valued town employees in alignment with our safety values. Next slide.
Hold on.
Mhm.
There. Did it go down too far?
It did.
Okay, there we go.
Okay, thank you.
Mhm.
Eligibility for FMLA employees must have at least 12 months of service with the town, must have worked at least 1,250 hours in the 12 months preceding the start of leave. Employees or eligible employees can take up to 12 weeks of job protected leave for one of the qualifying uses in accordance with federal, state, or local laws as they may be periodically updated or modified. And when does it apply? It applies for the birth of a child, placement of an adopted or foster child. The leave must be taken within 12 months of placement. Care of employee, spouse, son, daughter, or parent with a serious health conditions that make the employee unable to perform the functions of his or her job. And for qualifying exigencies arising from service members' active duty or call to active duty. And just note that FMLA allows eligible employees to take up to 26 weeks of unpaid job protected leave in a single 12-month period to care for a covered service member with a serious injury. The one thing that I did not add is if you have questions regarding the FMLA process, you can contact your HRD partner. Currently, Letitia Perry handles FMLA, so you can email her should you need to discuss FMLA. And you can go to the next slide. We Next, we'll be covering just the eligibility for our town benefits. So the eligibility is defined as an employee of all full-time employees working 20 plus hours, or I would say full and part-time employees working 20 plus hours a week who have completed their eligibility waiting period. The benefits for your medical, dental also cover your spouse or domestic partner and dependents up to age 26. Next slide. This is an overview of our medical plan highlights. We wanted to just cover some of the things you may frequently asked questions about as far as what the plan covers. The preventive care is at 100%. Your office visit copays are $20 for a copay for a primary care visit, 40 for a specialist, and the virtual visits through Teladoc are $10 per visit. Your prescriptions are covered at $4, 15, 35, 50, and then 25% to $100 max. For meal orders, it's 3 times the copay for the essential formulary. The copayment for emergency room visits is $300. Your urgent care visit is $40. And then the deductible is $250 per person covered, up to $500 for dependent coverage. Inpatient care is 100% covered after the deductible. Same for outpatient care. Your out-of-pocket max for the medical through Blue Cross and Blue Shield is $3,000 or $6,000 for dependent coverage. Next slide. The plan also includes your vision coverage. Of course, the vision plan only covers your eye exam. So we do not have a copay for the eye exam. If it's out of network, it's up to a $39 allowance. The frames and lenses are not covered under the Blue Cross Vision or Blue 2020 plan. We do have discounts available at the in-network providers at 40% off, excuse me, of complete pair of prescription eyeglasses or sunglasses, 20% off of partial pair of glasses, 20% off of accessories such as cleansers or solutions, and then 15% off of conventional contact lenses. Next slide. We do have, the town has a vision reimbursement program. Since our current vision plan does not include the frames, the town of Chapel Hill will reimburse members enrolled in the vision plan for eligible vision expenses such as prescription frames and lenses, contact lenses. Reimbursement maximum is $200 per enrollee per plan year. So you would just save your itemized receipts. You can grab the Vision Hardware reimbursement form off of the Hive under forms, and you would send that to me. The deadline each year is within 60 days of the end of the plan year. Our benefit plan year runs from September 1st to August 31st each year. So for anything up to August 31st, you have until October 30th to send us that reimbursement request. Next slide. Dental coverage is covered through Delta Dental. The plan year again is September 1st to August 31st. It's 100% preventive care. So your cleanings and x-rays are covered at 100%. Anything basic like a filling is going to be covered at 80%. If you needed anything major like a crown or bridge, then the town's plan pays 50% and you pay the other 50%. Orthodontic services is covered. I believe the plan maximum is per lifetime is $1,500. And then we do have an orthodontic rider with no age limit. The plan year deductible is $50 per member. Plan year benefit max is $1,500. Next slide. So we'll go into next our disability plan highlights, starting with the town provided short-term and long-term disability. The town pays 100% for your short-term disability and long-term disability. For the short-term, it begins after a 31-day it begins on the 31st day. So there's a 30-day waiting period, and that plan will kick in on day 31. The weekly benefit amount is 50% of your salary to a maximum of $462. The benefit period is 26 weeks, including the 31-day elimination period. The long-term disability waiting period is 180 days. The max benefit is 50% offset by state disability of your salary up to a max of $6,000. And the benefit period is to Social Security normal retirement age. Next slide. We also have a voluntary disability plan, and these are all benefits that if you decline these at your new hire orientation, then these are some of the plans that you can sign up for at open enrollment, which typically happens toward the end of June. So Symetra, the voluntary short-term disability coverage, is one of those where it's 100% paid for by the employee. But the difference between the Symetra plan and the Hartford is that there is a 14-day waiting period if you are out of work for a non-job related injury or illness. That plan is going to kick in on day 15. You can purchase weekly benefit amounts in $400 maximum. The benefit period is 26 weeks, including that 14-day elimination period. And they may request evidence of insurability if you are requesting or increasing your current amount for the Hartford or Symetra after enrolling when you're first eligible. Next slide. The town also pays in full for a basic life and AD&D policy in our employees' names at 1 time your salary up to a $200,000 max. There's an option to purchase additional voluntary life and AD&D coverage for employees in $10,000 increments up to the lesser of $500,000. We are guaranteed or and thank you, Anita. Accidental death and dismemberment is what AD&D coverage is. So you can purchase optional accidental death and dismemberment coverage for yourself in addition to what the town pays. Remember, the town pays for 1 time your salary, and you can purchase additional life and accidental death and dismemberment. Again, I think the guaranteed issue is $200,000 or 3 times your salary. Anything over the guaranteed rate requires that evidence of insurability. So if you are increasing your current amount over 1 increment or increasing over the guarantee issue, or if you're enrolling after you're first eligible, then the Hartford will send you a personal health application to assess evidence of insurability before that new coverage level takes place. You can purchase voluntary life coverage for your spouse or domestic partner in $5,000 increments up to the lesser of $250,000 or 50% of what you're covered under the voluntary amount. You have to enroll in at least $10,000 worth of coverage for yourself to enroll a spouse or partner, and they would be enrolled in half of what you're enrolled in. Dependent coverage for children up to age 26 is also available in either $5,000 or $10,000 rates. It's 52 cents per pay period if you purchase the $10,000 max for dependent life coverage, and I think it's like 26 cents for the lower amount. Next slide. I think the last two slides we'll talk about is just the flex spending account through Flores and Associates. So the flex spending account, or FSA, is the account that allows you to pay for certain medical or dependent care coverage, dependent care expenses with pre-tax dollars. Employees' contributions are deducted from each paycheck before federal income and Social Security taxes are calculated. You are not taxed, or you will not pay taxes rather, on eligible reimbursements. You can make changes during if you have a qualified event or at open enrollment. So if you need to make changes to your FSA account, that would be at open enrollment, or unless they have a qualified life event. The medical FSA participants are allowed to carry over $610 of unused funds from this plan year to the next plan year. Any amount rolled over will not decrease your annual maximum contribution. That carryover feature does not apply to the dependent care accounts. The next slide is just a list of the eligible expenses. So under the eligible expenses, it would be your medical, dental, vision copays, your deductibles for coinsurance, which we don't have coinsurance, but it would pay your plan deductibles for the Blue Cross and dental deductibles, your eyeglasses, contacts, supplies, orthodontic services, prescription drugs, over-the-counter drugs without an RX or without a prescription, menstrual products. What's not covered under the FSA plan would be any warranties for your glasses, for example, or any medical, dental, vision devices, cosmetic procedures, unless it's restorative, diet foods, health and fitness membership are not covered. Any missed appointment fees, toothpaste or teeth whitening services, and marriage counseling. And the dependent care, I'm sorry, go back to the annual limit. This plan year is $3,050. I think for our new plan year for September, it increases slightly, and we'll have that data in the coming months. The dependent care limit is $5,000. You can use that account to pay for before and after care fees, elder care fees, daycare and preschool fees. You cannot use it to pay for overnight camp fees or babysitting or any expenses taken as a federal credit. And I think that's the end of my portion.
Thank you, Star. You covered a lot in a little bit of time. Appreciate that. It doesn't appear that there were any questions or comments that came up. So we're going to keep this moving along. I'll hand it over to Anita, who will talk about the Ombuds program.
Thank you. Thanks. And hi, everybody. I can't see everyone, but I'm glad you're here today. And so I'm just going to take a few minutes. I want to first tell you a little bit about what an ombuds is, and then I want to sort of explain why an ombuds is considered to be a wellness resource, and then end up maybe with how you can reach me and the kinds of things that I might be able to assist you with. The first thing that I want you to know is that I'm what's called an organizational ombuds, which means that I'm available as a resource to you as a town employee, no matter where you work in the organization. You might be a frontline firefighter, you might be a supervisor, you might be a manager, or even a director. And part of what I do is I operate under 4 really important principles. One of them, and the key thing, is that every communication with the ombuds is confidential. I respect your confidentiality. I don't talk about what we've talked about. I don't share it with anyone without your permission. The only exception to that being if I think that there is a concern about imminent harm to you or somebody else, in which case I have a responsibility to make sure that you stay safe, and so do other people. The other thing is that my role is to be impartial. I am actually independent of the town. I'm not part of town management. I don't advocate or represent in any particular point of view. An organizational ombuds job is to help you explore your options and to think about what you might want to do next. I don't take sides. Instead, I help you think through what your choices are. And then an important thing that's valuable to a lot of employees that come to see me is that I'm an informal resource. Coming to see me doesn't make anything happen. You remain in charge of what happens next. So next slide, please. So here's how I work. The most important thing that I do is provide a safe space for you to talk about an issue or a concern. We'll explore options about the issue that you've come to help resolve a conflict or a concern. One thing that I do, though, is that if I start hearing a lot of people talking about similar things that are a problem in the organization, I may raise that to our management in a way that protects your confidentiality so that no one knows it's you or a group of you that brought that to me. Next slide. So why do people come to see the ombuds, and why is that considered to be a wellness resource? Because we know that a whole big component of wellness is what happens to you at work and how you feel about your work. And it's really important. People know, we know that people feel better when they feel like they have a trusted person that understands town policies and procedures and also respects your autonomy to help you think through when things are not going well at work. I mean, workplace stress, workplace difficulties, confusion about policies are things that can really impact people's well-being. So these are some of the things that I help people with, and I can tell you that I have talked with employees for every one of these things. I have spoken with employees that have been concerned about wrongdoing in the organization and don't really know what to do about that. Employees who are thinking about filing a grievance or a complaint. Sometimes employees that just don't know where to bring their issue. They don't really know what to do with it, and they want to kind of work that through. Sometimes a lot of what happens at work is that we have some interpersonal conflicts. I can help you with those. One thing that's really important is sometimes people come to talk to me because they think they might be experiencing harassment or bullying or discrimination or unwanted attention. And they may not be ready to make a formal step there. Sometimes people want to come to me to get a sanity check and to think through what they could do and what the consequences of various options might be. I do a lot of coaching to help people handle difficult situations. And sometimes people just come to see me because they just need someone to hold space so they can just share frustrations or difficulties. And I'm very happy to do that. Next slide. So why would you come see me instead of going maybe to your supervisor or to HR, in any one of a number of places? I think the key thing is that you always remain in control of what happens next. We explore different options, and I want you to know that I honor and respect all options. Sometimes you'll explore an option and you'll decide that for right now, you don't want to do anything. And that's a choice that you can make. And we talk about what that might mean if you if you choose not to do anything. And for some people, that's the best choice. For other people, they may want to engage a formal process, excuse me, and I can help you know what that looks like. I can help you know how to do that. I can't advocate for you in that process, but I can help you think through that might work and what might happen. I don't keep any records. I'm confidential and informal. And the big thing is that I'm not here to judge people. You know, we all bring a lot of experiences and we all have different ways that we respond to things. And it's important for me that you come to a decision that respects your own autonomy and your own authenticity. So that's a way that I can support you. Next slide. So how do we reach the ombuds? I want you to know I have two phone numbers. One is a town phone number that forwards to my personal cell phone, but you can also just call me on my personal cell phone. That's my number up there. If you do email me, I would just ask you not to be too specific about what you want to talk about. Although my email is confidential, you know, mistakes can happen, and I don't want anything to compromise your confidentiality. I meet people anywhere from 6 a.m. to 9 a.m. I just went to a 6 a.m. meeting with a group of employees not too long ago. It was great. And I will meet you anywhere except your home. I can meet you, I can organize a space in the town, or we can meet at a coffee shop. And I work with individuals and groups. And the big thing is, meeting with me is considered work time. If you want to, you can just tell your supervisor that you need to access one of your wellness resources, and you don't have to meet with me on your personal time. And I think that that's an important thing for you to know. One thing that I do want to put a big plug out there for is that we are on a effort. We introduced a program through the Ombuds Office called Mental Health First Aid. And that is a program to train all of our town employees who have an interest in how to recognize, identify, recognize, and respond to issues, mental health issues that we might see in the workplace. It's a voluntary training. We will be resuming those trainings in the spring. And it's a really wonderful resource that can help a lot of us become more confident in assisting people in the workplace that may be experiencing signs of some mental distress. So that's really the role that I play here. I love what I do. I'd like to help you. Please feel free to contact me. I don't know if there are any questions, but I would be happy to answer them.
Hey, thank you, Anita. That was all very helpful, and glad that you put in a plug for the mental health first aiders and the upcoming training. I don't see any chats that have come through, so we will go ahead and turn it over to Skylar, who is going to share with us the Employee Assistance Program.
Hi, everyone, and good afternoon. My name is Skylar, and I am an account manager at ComPsych, and I support the relationship between ComPsych and the town of Chapel Hill, and I'm just here to give you an overview of your Employee Assistance Program. You can move to the next slide. So Guidance Resources, this is just basically an overview of what we have. Guidance Resources is available 24 hours a day, so you can call at any time. You could call at 2 a.m., you could call at 4 a.m., you could call at 4 p.m. Someone will be there to answer your call. On the screen is just your 800 number where you can access those services, or you can visit your online website at guidanceresources.com and you can register with your web ID, which is COM589. The plethora of Guidance Resources program includes your Employee Assistance Program counseling sessions, your Legal Connect, Financial Connect, Family Source, and some CCBT tools. We can move to the next slide.
Hold on, just having a brief issue. Go ahead.
All right, your work-life services include your Legal Connect, Financial Connect, and Family Source. Legal Connect is an unlimited resource, so you can call in however many times you want, and you would have a 30-minute consultation with our in-house attorneys regarding any questions for legal services you might have. This could include any family law, will questions, bankruptcy questions, really anything in the legal sphere, as long as it is not a conflict of interest with the town of Chapel Hill. If you do need in-person representation, you can get a referral to someone who is an attorney in our network, and you would receive a 25% discount if you do decide to use them for your services. Financial Connect is also an unlimited service that is 30-minute consultations as well. You would call in, you would say, I would like to speak with a financial expert, and you could ask any financial questions you have, any questions about credit cards, maybe you're buying a new house, if you have debt questions, if you're planning for retirement, anything along those lines. And this is, again, all confidential and objective. And then finally, in the work-life sphere, you have Family Source. Family Source is kind of outside of the source of like anything else. Think of it like your daily to-do list. These things can be really fun. They can have items such as looking for childcare, looking for elder care, or maybe you're planning a vacation or you're planning a wedding. You would call in and someone would ask you questions along the lines of what is your budget? Where are you located? What are you looking for? And then within like 1 to 3 business days, you're going to get a packet of information of these vetted sources that our Family Source members have called. They've confirmed that they're in your budget. They've confirmed that they're available, and you can access them, as well as emergency care. Maybe you're looking for shelter resources, for food resources, for anything like that. And for those emergency issues, it is a 24-hour turnaround. And we can move on to the next slide. And then we have our confidential counseling. So this is short-term counseling through your EAP. This is strictly confidential. None of your personal information gets back to the town of Chapel Hill. And our records are maintained here at CompPsych. You have 5 sessions per person, per issue, per year. All of the CompPsych services are available to you and your household members. We define household members very, very broad. So you can think of it like there's a magnet on your fridge. Who can touch that? Like maybe you have kids away at college, they can access that. Maybe a family member has come to stay with you and they are looking for resources on how to get back to their feet or something's going on. They can access your EAP services. And then, of course, the employees can access the services as well. This is at no cost to you. None of these services have any cost to you. It's confidential. It is voluntary. And we can move on to the next slide. And then we have our CCBT program. This is through a program called COA Foundations, where it's a platform of digital self-care tools that can help you tackle stress, depression, or other common mental health issues. It's interactive, it's user-friendly, and a self-contained wellness solution. It's also clinically proven to enhance mental health and well-being. This is not a therapy or a treatment for therapy, but rather a digital resource. It can supplement face-to-face therapy if maybe you're not ready to take the plunge into seeing a therapist yet. You want to work on some things on your own. And it can broaden the access that you have and can just help you understand maybe what you want to focus on more before you take that to a therapist, or maybe you stop there. And you can move on to the next slide. And then we have our digital platform, which is Guidance Resources Online, or GRO for short. This is a fantastic resource. When you log on, you can access things such as articles, on-demand trainings, help sheets. You can actually search for elder care facilities and child care facilities on this site. This has an abundance of resources related to wellness, to relationships, financial, legal, anything along those lines. Like maybe you're trying to prepare for retirement. You could find articles on what that looks like, what's a great place to start when it comes to planning for retirement. Or maybe you're going through some personal issues and you're just looking for ways to deal with that or stress. There are great stress techniques on here. There is a plethora of resources on here. And if you have any questions, you can always call your 800 toll-free number and get more information on what our live services are and how you can access that with our other in-house services. Then we can move on to the next slide. And then this is just our contact information again. Again, we are available 24/7. So at any point you can call us and someone is going to answer. The 800 number is right there. It is 800-272-7255. When you call, you're going to be met with a guidance resources or guidance specialist, and they're going to ask you the company that you work for. They're going to ask you your name, probably your date of birth, just some general demographic information. And then they'll go through an intake process with you. They'll ask why you're calling, how you're feeling, things are going on. And this is the point that you'll say if you want to use either your Financial Connect, your Legal Connect, or your Family Connect, or your Family Source resources, you can bring that up here and they will connect you with the correct department and get you the right answers that you need, or they will walk you through the process to use your EAP counseling. Our guidance specialists and guidance consultants are all master level clinicians, so you can bring any questions to them, but they will direct any therapy sessions into the EAP counseling. And with that, that is all that we have for the EAP. If you have any questions, I'm happy to answer them.
Okay, thank you, Skylar. I'm so glad to know that if someone is planning a wedding, that they can call for advice on how to pull that off. That's pretty exciting. And I really appreciate too I saw on one of the slides how that if someone is a first responder, then and they're seeking help, to make sure to share that so that they can be connected with the best resource for them. So thank you for
Absolutely.
that. I don't see any other questions in the chat, so we will move it along to the next slide. Oh, one back, Marnie. Yeah. Okay, thanks. So
Right.
there we go. Yeah. So just a quick review of programs, and then we have Natalia and Charlie, who's going to be sharing some about their programs within Wellness at Work. But just in review, employees under the town's insurance have free access to the town gym and pools, but all the other programs like Lunch and Learns, wellness challenges, book clubs, all of that is available to all employees and pre-65 retirees. We have, that's our website there. And so you can be able to stay up to date on what programs are being offered by visiting our site. Next slide. And just to review of the wellness clinic staff, Adam Goldstein there, top left, and he's the medical director. He's a physician at UNC Family Medicine. Myself, and then there's Robin, top right, who is a family nurse practitioner who shares clinic duties with me. Bottom left is Charlie, the tobacco cessation specialist, a clinical social worker. Kiva, who is there in the middle, is family medicine staff who helps with events. And then Natalia, bottom right, who's the dietitian. Okay, next slide. So just to remind people that the clinic is free for all employees, dependents, and pre-65 retirees covered in the town's insurance. The same as with ombuds, when you are coming to see us, then it's work time. You don't take vacation time, completely confidential. No information is given to your supervisor. We have daily walk-in hours and also by appointment. And then starting during COVID, we started doing a lot more things virtually or telephone, and we still do that now. We are located in the bottom of the town housing office on Caldwell Street. And then next slide. Yep. So we are pre-pandemic. Barbara, who is the old tobacco cessation specialist, and myself regularly had clinics at Transit. So we're excited to be able to return to that. Charlie and I had our first day at Transit on Friday, and we will be there every Friday. Charlie in the morning, and then I take over in the early afternoon. And just a quick review of everything that we offer: flu vaccines, health coaching, chronic disease coordination, quitting tobacco, nutrition, weight management. And then Charlie's going to be talking about a new program that we'll be offering, the chronic behavioral therapy for insomnia. And next slide. I think I said chronic. It's cognitive behavioral integrity. Anyway, there you go. He'll talk more about that. And keep in mind that for anything that occurs after hours, Monday through Friday, where you need to be seen, then for town employees going to the Family Medicine Urgent Care Clinic on Manning Drive, the co-share for that urgent care visit will be waived. So with your badge as an town employee, then that will be waived. And next slide. So sometimes people wonder, well, where should I go? I guess I just need to go to urgent care. I've got back pain. That's where I need to go. Excuse me. Really, if you see everything over on the left side of things that we can see in the wellness clinic, it's a lot of things that people might first think, I guess I need to go to urgent care. No, you can likely come to us. We do say that, the things that are on the right side in that first box, you do want to go to urgent care or call 911 for those kind of situations. Trouble breathing, a laceration that's going to need sutures, you know, a bad, unusual bad headache that has started suddenly, certainly seizure, sudden confusion. And definitely want to call 911. That's in the red box for chest pain, including pain in the arm or jaw, stroke symptoms, which include face drooping, arm weakness, speech difficulty, passing out, fainting, loss of consciousness. In pink there, you know, we say, are you pregnant? You know, if it's something that is pregnancy related, then you want to check with your provider. But if you're pregnant and you've got a sinus infection, then you can sure start with us. And I just tell people, remember, if you have a question about where you should be seen or what you should be doing, give a call. You know, we are available by phone. When I'm not in the clinic phone forwards to my cell phone. So leave a message and we will call you back. I don't see any questions for me. So I'm going to turn it over now to Charlie to talk about tobacco program.
Thanks, Liska. Hey, everybody. So I'm Charlie. I'm the tobacco cessation counselor at the Wellness Clinic. So I'm a licensed clinical social worker and a licensed clinical addiction specialist. And one of the things I do with the clinic is I offer our tobacco treatment program. And some of you may be aware of it, but really what it looks like, we use the word counseling, but it really is more like coaching. So what we would do is if you were to be interested in the program, or say Liska or any of the clinic staff were to refer you to me, we could just set up a time and have, you know, an initial conversation. That usually those are anywhere from 20 to 30 minutes, sometimes an hour. It just depends. But we just kind of come up with, what are your goals with quitting tobacco? And that's any tobacco product. That's smokeless tobacco, it's cigarettes. If you have questions about e-cigarettes, please feel free to come to me and ask any questions that you have. But yeah, we would first set up an initial appointment, and that can be any time. I mean, I can meet you anywhere at workplace. Like Anita said, I can come meet you somewhere. I can also if it's easier just to do it over the phone or video, that works too. It's very accessible. But then we just kind of come up with a plan, and you know, I can go through all the different treatment modalities that can be helpful, the different medications that we offer at the clinic, answer any questions you have, and then sort of come up with a plan for, okay, how do you want to proceed? Do you just need the information from the one appointment and that's all you need? That's great. If follow-up is helpful, I absolutely do that. I have people I follow up with for a number of weeks just to help them get over the hump of quitting. So just to reiterate, we do offer free medications. There's a lot of them, so I don't really have time to go over them now, but if you have any questions about them, I can tell you everything you need to know about them. But after 6 months of being tobacco-free, we offer a $100 gift through UNC Family Medicine. And then after 12 months, we offer another $100 wellness-related gift. So if you have questions about that, reach out to me, reach out to Liska. But that's just a way to, you know, help incentivize change and just give you something to work toward. And if you have any questions about it, give me a call. It's 919-923-3774. Leave me a voicemail. It's a personal phone for the clinic, so you can also text it. It's an iPhone, so if texting's easier, or if you just like to set up an appointment and you have a few minutes, send me a text. Hey, I'd like to meet for 20 minutes. Do you have time? Absolutely willing to do that. So it comes right to me. You can go to the next slide, Marnie. So I included this slide just to give an idea of what treatment looks like, and that's really, there's a two-tiered approach. If you could just click one more time, Marnie, so I can show the other. Yeah, there we go. So what I try to do is help treat both the physical and the psychological elements of smoking. So what physical typically looks like is medication. And if medications are helpful, if you're interested in medication, we can certainly talk about that. But if someone's not interested in medication at all, there's a lot of other psychological strategies or treatments that you can go through, that a lot of them are like tips and tricks to, you know, kind of trick yourself into quitting smoking or quit using tobacco. But and a lot of this is whatever works for the individual. So there's, you know, each treatment plan is definitely different. We know I always say that, but it is very different for each person because people just have different goals and different ways of wanting to get to those goals. So I just wanted to show that, because there's really, when these two are paired, both counseling with, you know, talking with me, goal setting, also paired with medication, then likelihood of someone quitting just goes up exponentially. So in combination, they're both effective than either is alone. And pharmacotherapy triples quit rates. I like to include that just because the FDA medications that we offer here at the clinic really do have an impact, and people seem to have it's very helpful for most people. So we can talk about options. If you're curious, just please feel free to give me a call. You can go to the next slide. And as Liska was saying, we are offering a new service in 2024, and it's cognitive behavioral therapy for insomnia. It's very similar to what Skylar was talking about with the computer system, but this is just meeting with me. And so part of my work, I am a trained therapist, so we would go through, but this is very structured. So it's not the kind of therapy that maybe you've seen on TV or heard people talk about where it's getting into the nitty-gritty of, dreams or your relationships with your family. It's not really that. It's more of a formulated way of resetting your internal clock. So a lot of people just have issues because of work schedule or, what have you, that sleep just gets knocked off. And this is all about resetting that clock so you can start getting enough sleep at night so you feel refreshed in the morning and you feel like you can, you're not having as much anxiety or you don't feel as much stress about falling asleep. So it's really strategies, but it is very formulated. And the aim is to improve sleep quality. And I like to include this. It's shifting from trying hard to sleep to letting sleep happen, just letting your body do what it normally does. And it's realigning the clock, our internal clock. And it's very effective. 70 to 80% of patients with primarily, insomnia see improvement. So if you have something like sleep apnea, restless leg syndrome, we may have to have another conversation about referring to a sleep clinic for a little bit more intensive care. But the main components there on the right are stimulus control, which a lot of that's some things you might imagine, like limiting screens at night. Sleep restriction is about limiting time in bed, just because people with insomnia tend to spend more time in bed, but less time sleeping in bed. So watching television, stuff like that. So limiting the time you are in bed to just sleep. Sleep interfering behaviors, things we all may do that just impact a restful night's sleep. Food and substances, you can imagine things like caffeine have an impact on sleep. Many people already know that. And then talking about your individual biological clock. What does that look like? Some people it's earlier in the day, later in the day. If you're somebody who works at night, that's completely different too. So that's also a large part of this treatment. But if you're curious, again, feel free to give me a call. I'll be hopefully doing a lunch and learn on this specific topic, this one slide. So there's a lot of information in this one slide, but if you have any initial questions, feel free to give me a call or email me too. And that's all I've got. If there are any questions, I'd love to answer them.
Yeah, thank you, Charlie, for going through all that. And pretty exciting that you're going to be offering the CBTI program. So that's great. So last up, we have Natalia, who is the clinic dietitian, and turn it over to you now.
Hi, good afternoon, everyone. Thank you for joining. I just wanted to share a little bit of information about what I do, what dietitians do, and what services I offer through the Wellness Clinic. Next slide, please. So what dietitians offer usually is medical nutrition therapy. That is a pretty intensive, individualized, comprehensive nutrition plan to either address, prevent, or help with managing certain chronic diseases. It's a very individualized and thorough assessment of where you as an individual are with your food habits. We also include some other lifestyle habits like sleep and activity and exercise too. And then that combined with whatever your health goals are, if it's preventing or treatment of a chronic disease, or if you just want to learn about healthier eating. Similar to what Charlie was saying, I kind of see some people who just want to get nutrition education and take that and learn from it and go and do it by themselves. And then I also have some people who come back regularly every few weeks, every month, and they want to focus on maybe more smaller lifestyle behavioral things and maybe a bit more counseling and smaller changes one at a time. So I can address either approach, just to kind of depends on what you are interested in and what your particular goals are. Yeah, next slide, please. And I just wanted to include a little bit of information about the variety of different conditions or diseases or situations that can be helped or addressed with nutrition or medical nutrition therapy. So there are several different ones. I feel like people often think that I'm the food police or I'm going to be judging whatever it is that they have, and that's not the case at all. I'm more just, trying to think about what particular diet or nutrition we can use to address all of these different conditions or situations. Another common question that I often get asked is if people come and say that they just want a meal plan. And generally, we don't create meal plans for these specific diets, but it's more about teaching you how to manage that condition or that goal through nutrition. So I think of that saying of give a man a fish, you feed him for a day, but teach a man to fish, you feed him for a lifetime. So more about the teaching you about nutrition and your condition or goals and how you can accomplish your goals with nutrition. Thank you very much. That's all I have.
Yeah, thank you, Natalia. Just appreciate how you mentioned that you don't provide people a meal plan that they must follow, and I point that out all the time to people. Recognizing that you're meeting them where they are and their schedule and their routines and what's important to them, and figuring out how to go from there. Natalia is seeing people in virtual visits, and if you ever, need to connect with her or with Charlie, then please, call me. The clinic number is on the back of your employee ID. So that's a great way to do it. And I also mentioning that, and I don't know if Star is still on here, for new hires now, is the new EAP number listed on the back of the ID badge?
I think we adjusted that. Star had to drop off, but I believe we have adjusted that on the new ID badges.
Okay, great. Thank you. Thank you. Glad to know that. We really do like to think of, kind of all those supportive services, the wellness clinic, ombuds, and EAP, all easily accessible, those numbers on the back of employee IDs. Let me just check the chat here. I don't think that we have anything else. A comment from Allison, great information all, thank you. Yeah, I don't know if anyone has any, we've stayed on time very, very well. So thank you all for containing a lot of information in a very short period of time. This will be on the website. So, let your coworkers know or your family members know that, that we will be posting that before the end of the week. It will be on the Wellness at Work website. But we have a few moments. I know a lot of people have to leave now, but for anyone who has any final comments or questions, then all of the presenters will stay online here for a bit to take those. Thank you. Going to jump ahead of another meeting, writes one person. Okay. I don't see any other questions. So thank you all so much. This has been very valuable, and everyone's time is so appreciated. So thank you all.
Thank you.
Thanks, Liska and Marty, for organizing.
Yeah, thank you.